Hello and welcome to DCA TV. I'm your host Salika J and I'm here today with Dr. Wiliam Virtue, dentist at Virtue Dental Care. Dr. Virtue has dedicated his professional career to provide patients with the best of what dentistry has to offer with the highest standards of health and safety. Dr. Virtue practices mercury-safe, biocompatible dentistry in accordance with the highest standards of health and safety, as outlined by the International Academy of Oral Medicine and Toxicology, which he was also the past president, the leading association of dental professionals committed to biocompatible dental practices. We are delighted to speak to him today on a few topics which will give us a clear idea of some of the common dental procedures. Welcome Dr. Virtue to DCA TV and thank you for being on the show today.
Well, thank you for the opportunity to speak to you.
Today, Dr. Virtue will enlighten on some of the common questions you may have for cosmetic dentistry. Dr. Virtue, can you tell us what is cosmetic dentistry?
Well, cosmetic dentistry, a lot of times in patients' mind, is the pre-smile, the 6 front teeth they're looking at. And obviously, we want everything we do to be cosmetic. In our practice, in any biological dental practice, we're not going to use any metals if we don't have to. So everything we put in the front of the mouth or in the back of the mouth, we want it to be beautiful, and we want it to look like a tooth. In other words, if we restore a posterior tooth or a tooth in the back of the mouth, when I'm done, I want that tooth to look like it did when you were 6, 8 years old, instead of showing metal or anything tarnished or not tooth colored, you might say.
Who is a good candidate for cosmetic dentistry?
Well, anybody really is a good candidate. If you're concerned about biocompatible dentistry, that's a good candidate. Anybody with missing or crooked teeth, stained teeth, anybody with a whole lot of fillings in their front teeth that have stained or yellowed over the years, that's an excellent opportunity to do cosmetic dentistry. And as we get older, our teeth wear. We have these 7 days a week and 365 days. We use them 24 hours a day, and teeth wear, and we don't have anything, cars don't last that long. So as we get older, our teeth wear, they crack and they break, and that's where we're able to come in, cosmetically restore these teeth.
Is cosmetic dentistry worth the time and the cost?
Everybody comes in the office with a different goal, and we try to find out what that goal is, what the patient's interested in accomplishing. That's the question we ask. And if it's aesthetic dentistry, then we can focus on that. Some people just come in and say, look, I just want, what if it's broken or decayed, I want it fixed. Some people don't care what their smile looks like. But more and more people are more conscious about the aesthetics and want to look more youthful and have the teeth looking like they did maybe 40 years ago.
How long will my new smile last?
Oh, your new smile will last for years. I've got patients that I put veneers on 20 years ago and they look great. It's a little bit dependent on how well the patient cares for it too. If you're a grinder or a bruxer and you clench your teeth and rub them at night, you need a night guard. Those kind of people broke their original teeth and they can break veneers or crowns. But with proper care, aesthetic dentistry can last 20, 30 years without a problem.
Thank you so much for your time, Dr. Virtue, and for being with us today. It was a pleasure.
Well, thank you. I appreciate it.